Well, welcome back, friends, once again. Well, we are now going to talk about the differences or the highlighting points of S-amlodipine when you compare it with the racemate. Well, half-life of S-amlodipine is 49.6 hours as compared to 44.2 hours for the racemate. Well, duration of action definitely is longer for S-amlodipine, and for the racemate is shorter. Then variability in clearance is more in the racemic form, whereas it is least in the S-amlodipine. Well, activity at the calcium channels is 1,000 times more active than your R-amlodipine, and activity due to S component is more than that on the racemate also. Then safety in the elderly. Well, when here we talk, this medicine is more safer, and whereas your racemic amlodipine builds up in the elderly and higher incidences of peripheral edema. Well, control on blood pressure. Well, the S-amlodipine faster than the racemic amlodipine, whereas slower than the S-amlodipine for the racemate. Well, homogeneity in blood pressure control is smooth with S-amlodipine, whereas the racemic mixture is less homogeneous than the S-amlodipine, and effect may be lost at rough hours of dosing, that is in the early morning hours. Then incidence of peripheral edema, this is negligible, whereas it is dose dependent and averages approximately 22% with the racemic mixture. Now going on to the next slide, well, this is an important slide when we talk about the effects of amlodipine as compared to S-amlodipine on the vascular and endothelial function in patients with hypertension. Well, this was an original article which was published recently, and the doctors and even the pharma companies are now talking about something called as ENOS, that is, we'll talk about it now. Well, we'll talk about it later. First we'll just understand what does endothelial dysfunction cause to these patients and how is it related to hypertension. Well, the endothelial dysfunction, it increases the oxidative stress, and it increases products like low density lipoproteins, and this decreases the bioavailability of nitric oxide. Well, nitric oxide, if you remember, it causes it's a vasodilator, and it brings down your blood pressure, or in patients with hypertension it causes a fall in the blood pressure due to vasodilatory action. So when there's a decrease in the bioavailability of nitric oxide, then definitely the vasodilatory effect will be lost and it might cause hypertension. Then what does amlodipine per se do? Well, amlodipine, it activate ENOS. ENOS is a key enzyme which is involved in nitric oxide production and increases the levels of nitric oxide. NO stands for nitric oxide. ENOS is an enzyme, nitric oxide synthase. ENOS is an enzyme. E and N stands for nitric oxide synthase. Then what does this enzyme do? Well, it decreases the degradation of nitric oxide by the free radicals, and lastly, it increases the bioavailability of NO, which reduces your blood pressure. So we'll do a recap again of this study. Well, the endothelial dysfunction due to an increased oxidative stress and the production of LDL decreases the bioavailability of nitric oxide, which leads to hypertension. Well, amlodipine, it activates ENOS, which is a key enzyme nitric oxide synthase involved in nitric oxide production. It increases the nitric oxide levels. It decreases the degradation of nitric oxide by free radicals and increases the bioavailability of nitric oxide. So amlodipine has 4 roles when it is related, and when we discuss it with relation to enzyme ENOS, right? And its role in reduction of blood pressure in hypertensive patients. Well, now we are going to talk about the clinical efficacy and the studies which we have conducted for S-amlodipine. Well, there are many studies. The most important are the SCSA1 and the CSA2, then followed by micro CSA1, which is for the ISH, and then micro CSA2 for the elderly. Then we have the CSA angina. Then we have the CSATM, then we have with Asomex atenolol. Then number of small group studies have also been conducted, like sample size of 50 patients and 200 patients. Well, we'll talk about most of these studies in details in the mind map form, so that there you can draw and remember them lifelong. So let's talk about these important clinical studies which have been conducted by MCure. Well, the first study which we are going to talk about is the small clinical study which was done by Dr. M.S. Hiramat and Dr. Dige, and the objective of this study was to establish the efficacy of 2.5 and 2.5 milligram amlodipine versus 5 milligrams of racemate. While in this study, 50 patients were enrolled for 6 weeks, and the original BP was 150/98, which was your threshold blood pressure as per the JNC8 guidelines, and your goal BP was 130/84, which was achieved after treatment with 2.5 milligrams of S-amlodipine. Well, this was a study which was published in JAMA, India 2002, and it was a randomized, double-blind, double-dummy, parallel group comparative clinical trial of S-amlodipine 2.5 milligrams versus 5 milligrams of amlodipine. Well, what was the outcomes of this trial? Well, a reduction in supine systolic blood pressure of 27/16 millimeters of mercury was obtained with S-amlodipine, and reduction in systolic blood pressure of 22-23 millimeters was obtained with amlodipine. So there was a reduction in both the drugs, like for example with the S-amlodipine 2.5 and 5 milligrams of the racemate in your systolic blood pressure. While supine diastolic blood pressure reduced 14.17 dot 11.84 millimeters of mercury in S-amlodipine group, and 13.68 to 9.06 millimeters of mercury in amlodipine group. So there was a reduction in the diastolic blood pressure at the half the dose. So what was the conclusion? Well, S-amlodipine 2.5 milligrams is found to be equivalent in its efficacy and tolerability when compared to amlodipine 5 milligram in the treatment of mild to moderate hypertension. Well, now we come to know that S-amlodipine at half the dose is equivalent in its efficacy and tolerability when compared to racemic amlodipine 5 milligrams. Well, this was the outcome or the conclusion of this 50 patient trial. Well, then there was another study which was done. Well, this study I want to highlight it in the form of the graphs which are mentioned there. You can very well see it again, and this is just for better understanding, nothing else. Well, we have already discussed that it reduced the blood pressure in supine position in the systolic as well as in the diastolic blood pressure. So you can see here that before treatment and after treatment reduction in the blood pressures in the systolic and the diastolic blood pressure. So both the treatments significantly reduce systolic and diastolic blood pressure after 6 weeks of treatment, and there was statistically no significant difference between reductions affected by the two drugs. So now we go on to the next slide. Well, I have not drawn a mind map for it because again this was a small study of 50 patients which was done by Dr. P.G. Kerkar from KEM Hospital, Mumbai, and again it is highlighting that S-amlodipine 2.5 milligrams with amlodipine 5 milligrams in the treatment of hypertension, which was published in Indian Journal of Clinical Practice 2003, and it highlighted that here also both the drugs are equally effective in reducing the blood pressure. So reduction in the systolic is reduction in the supine diastolic, and the reduction in the supine systolic blood pressure. So you can see before blood pressure again 150 is the original blood pressure of the patient before treatment, and after treatment it is 130. Here it is approximately nearing 100. Before and after also it has dropped down to approximately 84. So again this was highlighting the benefits of giving half dose S-amlodipine over 5 milligrams of racemate. Then we go on to the next. Well, this was the trial which was on 200 patients, and a number of doctors were involved, like Dr. Lekha Patak, MS Hiramat, PG Kirkar, and UG Manade. Well, the objective was to compare the efficacy and tolerability of 2.5 milligrams S-amlodipine with 5 milligrams of amlodipine in treatment of mild to moderate patients with mild to moderate hypertension. Number of centers were 4. There were 97 women and 103 men. 6 weeks the trial went on. This was published in JAPI in March 2004. It was a double-blind, double-dummy randomized comparative trial, and both the drugs produced significant fall in standing, supine, and sitting blood pressures after 6 weeks of treatment. So it was effective in the standing, it was effective in the supine, as well as it was effective in the sitting positions when the blood pressure was measured, and there was no significant difference between the reductions affected by the two drugs. Now, no adverse event was observed with any of these two drugs, and half dose of S-amlodipine thus produced results equivalent to the full dose of racemic amlodipine. Well, again, I would like to highlight that this was a study done at 4 different centers, and the conclusion was S-amlodipine 2.5 milligrams is found to be equivalent in its efficacy and tolerability when compared to amlodipine 5 milligrams in treatment of mild to moderate hypertension. Well, in the initial studies which were done, well, we said it was the supine blood pressure. Supine means when the patient is lying down flat on the bed. And when we talk about here, in this study of 200 patients, the blood pressure was measured in standing position, it was measured in lying down position, and it was also measured in the sitting position. So 3 types of blood pressure measurements were carried out on all these patients, and it was to compare finally and to conclude the efficacy and tolerability of S-amlodipine over 5 milligrams of amlodipine. Thank you.